Good afternoon, ladies and gentlemen. Our webinar is now going to begin. My name is Steve Love. I'm President and CEO of the Dallas-Fort Worth Hospital Council, and we want to thank each of you for taking the time to be here for this educational webinar, and it's hosted in coordination with Texas Women's University, who is an associate member of the council. And today's topic is Don't Miss the Moment, Workforce Funding Your Texas Hospital. You can use now to solve critical staffing shortages. This is a hot topic. As you know, workforce is a big topic. And some of the pressures that you deal with, high vacancies, rising labor costs, and, long hiring timelines. Sometimes traditional recruiting just doesn't keep up with what your needs really are. The good news is this moment brings some opportunities, and the new workforce funding, including Workforce Pell and Workforce Board dollars, gives hospitals a path to build faster, more affordable talent pipelines. And with agency and overtime spending at high levels, taking advantage these funding streams can shift the financial picture for organizations that move early and quickly on this. So today's focus is how your hospital can use these funding streams to reduce vacancies, strengthen retention, and launch job-ready talent as soon as the very next quarter. We're joined today by two outstanding leaders. First, we're delighted to have Monica Christopher with us. She is president of Texas Women's University in Dallas. And we also have Jason Aubrey, who's the founder and CEO of Skilltrade. I have a couple of administrative things I do want to cover before we begin. First, there's going to be an open discussion. I'm going to kind of moderate the discussion, a little different format than we've used in some of our webinars, but we still want you to have the opportunity to ask questions. So if you'll type any questions in the question box, we'll answer them before the end of the webinar. And, examples, reactions, anything that you want to give us will certainly be useful. An additional note is we're going to let each speaker introduce themselves, but we're pleased to have both of them with us. But before I begin the questions, Monica, I'll turn it over to you to introduce yourself, and then we'll hear from Jason.
Sure. Well, thank you, Steve. I appreciate the opportunity to be with everybody today. This is a topic that's near and dear to our hearts at Texas Women's University. For those who are not familiar, TWU is a state university. We have three campuses, our primary campus in Denton, and campuses in the Medical District in Dallas, as well as the Texas Medical Center in Houston. We serve about 16,000 students across our three campuses. And here in Dallas, we really are very focused on allied health professions. So we train and prepare nurses from BSN all the way up to DNPs and PhDs and everything in between. We offer clinical doctorates in occupational therapy and physical therapy, as well as PhDs in both of those disciplines. And we also have a burgeoning healthcare administration program that's really designed for working professionals who want to advance their careers in the sector. The MHA program can be done primarily online and can be paired with an MBA. But we're also thinking creatively about how we serve a broader population of learners through short-term credentials and upskilling, and that's really the topic that we're here to talk about today.
Thank you, Monica. Jason, would you like to give us a little background and please introduce yourself?
Yep, absolutely, Steve. Thank you. Hi, everyone. My name is Jason Aubrey. I'm the founder and CEO of Skilltrade, a workforce development platform focused on solving critical staffing shortages in healthcare, predominantly for entry-level roles that can lead to a certification, such as sterile processing, surgical technicians, medical assistants, and soon patient care technician and a few other programs. We generally really focus on connecting the dots within a community, working with higher education partners like TWU, working with workforce agencies, other federal or state agencies and nonprofits to help bring funding to the table to help solve critical staffing shortages, as well as working with directly with employers on building sustainable talent pipelines that actually lead to retention. And we're certainly very excited to have this conversation today and hone in on some of the more specific details and capabilities of our organization.
Thank you so much, Jason, and we'll get right into the discussion. And I think this is probably a question that both of you will want to weigh in on, but let's look at the state really of the workforce in Texas right now. If you were looking at hospitals, what is one major shift or change that you recommend that hospitals do now to build a more stable workforce?
Well, why don't I go ahead and jump in with just some statistics to kind of set the scene, and then Jason can jump into more of the specifics around healthcare. But the Texas Workforce Commission tells us that by 2030, there will be a need for 1 million more credentialed workers in Texas. We know the economy continues to boom here, and that certain sectors, are really feeling the pinch of that growth exponentially. Certainly in the Dallas-Fort Worth area, we know that healthcare, continues to just be on this wave of aggressive growth, and that there are lots and lots of jobs that continue to go unfilled because there aren't enough skilled workers with the right experience or credentials and education to be able to fill some of those positions. We also know that there are 5.4 million Texans who have some college but no credential. So that means they're really not qualified or don't have the right experience for, again, some of these high demand positions that will offer them a lot of opportunities for economic mobility. So that's really the population that we want to focus on today. How can your institutions, really tap into those adults who, want to have the ability to have a career path that's fulfilling, the pain points that you're feeling and filling various positions and clinical roles that, continue to be vacant and really tough to recruit for, where it's really a win-win for everybody. Jason, do you want to talk specifically about some of the shifts in hospital workforce needs?
Absolutely. And just to add to that, right, I think there's obviously a need today, but there's some strategies that you can deploy short-term and long-term. At a high level, I really think that hospitals should, shift in parallel strategy from buying talent to manufacturing it. So I think the traditional model, right, for competing for the same supply of credentialed individuals, right, it's a shrinking talent pool. And it's very competitive, and it's kind of a race to the bottom, right? You're kind of having conversations with employees about wage increases or sign-on bonuses or relocation costs. Now, you definitely likely need to do that today, but there are other strategies that you can deploy for manufacturing that talent. That talent will stay with you, so increasing retention, and doing so by working with potentially training organizations, higher education, who offer more short-term programs that are very affordable. In addition to that, I think what I'm excited to talk about in this webinar is thinking through like successful strategies to do that aren't cost prohibitive, right? We know that budgets are obviously a very serious concern right now, and there's many ways that you can bring funding to the table, whether it's through apprenticeship training or incumbent worker training, right? Like actually identifying internal, we call mobility candidates, or the hidden workforce that you can upskill. There's a lot of opportunities to work with different varying sources of talent, job seekers. They're out there. And one of the issues right now is that they're not really aware of some of the more economical paths towards employment that actually have a positive ROI in their education. And again, there's ways that we can kind of help improve that retention. So certainly excited to dig in here and discuss all that in more detail.
Monica, I was thinking about, I know all places do strategic plans, and I'm confident that TWU does strategic plans. So when you look at it just from the Dallas perspective, how does the TWU Dallas plan really look to support the workforce needs of North Texas hospitals?
Yeah, so last year we spent really the first 9 months of the calendar year developing a strategic plan specifically for the Dallas campus. TW is now a system of higher education, and so our ultimate goal is to grow this campus to be a standalone independent university within the Texas Women's University system. And we looked at a lot of workforce data and, supply and demand, what other peers in higher education are delivering in terms of the degrees that they're graduating and specific needs related to the workforce. And we really landed on this idea that the TW Dallas campus needs to kind of embrace this urban identity. And that, one of the things that TW has historically done really well is support non-traditional learners. So individuals who may be working full-time and going to school part-time, job changers or career changers, individuals who are parenting or maybe are first-generation students who need a little bit more of the support around them to be able to complete a degree or credential. The other thing that we really landed on, though, while we're going to be expanding our academic programs and certainly adding to our healthcare portfolio, but also programs like business and some other disciplines outside of healthcare, we really weren't serving this population of individuals who for whatever reason, a bachelor's degree is just not in the cards for them. Maybe it's affordability, maybe it's time, and that they need to be earning and learning at the same time. So how could we offer these short-term credentials and trainings that led directly to employment opportunities that, again, they could have a career progression like Jason was describing within their existing employer, and then figuring out ways to share the cost burden and make it very affordable and efficient for them, both in terms of the financial side, but then also in terms of time. And that's where we've introduced a whole portfolio of these non-degree pathways that we're calling TW Ventures that are really very much aligned with workforce needs. I think the beautiful thing about TW Ventures is we can co-create things that match employers' needs. So unlike traditional academic programs that take 1.5 to 2 years to go through all of the approvals and development and so forth, with partners like Skilltrade, we can lean on their really excellent rigorous curriculum and delivery pathways to be able to co-design with employers solutions to meet their existing needs. So Ventures is working in parallel with TW, but again, it's really designed to be very flexible, very innovative, very short-term, and yet map right into those needs and high demand occupations within our region.
As you look at what Monica just said, Jason, and looking at job-ready candidates, what would you consider some of the underutilized candidate sources that hospitals should be tapping into? And how can training models change and help access job changes, non-traditional learners, and really dip into that community talent? I know that's a full loaded question, but what are some of those areas people can look to you to get advice on?
Yeah, what I was saying earlier, it kind of goes beyond just posting a job position and trying to bring candidates who are already credentialed and experienced in this space. And what we're finding right now is there definitely are those individuals, but the supply is just not there to meet the demand. And so to your point, like asking this question around, what are the different kind of talent pools that we can be looking at Skilltrade, we like to call them the hidden workforce. And we partner with organizations in a number of different ways to identify those hidden workforces. So let's think about internal mobility candidates, incumbent worker training, right? Like if you're a large health system, you probably have a large number of employees across, call it environmental services or food services, might be working in the cafeteria, or entry-level positions that are really good opportunities for incumbent workers to take a short-term training program, to upskill, and to help you solve those critical staffing shortages. And it's a win-win for everyone, right? That individual can get a wage increase. You know that you're very likely to retain that person because you know they've been working with your organization for 1, 2, or several years. So I think there's a hidden workforce within organizations that you could be using, identifying, and then deploying those education as a benefit or tuition reimbursement dollars in a more strategic way. Not just thinking about it as a retention tool to keep someone in their current role, but using those dollars, which are tax deductible, to help you fill critical staffing shortages and to help people increase their wages and improve retention. Now, there's other opportunities to identify, untrained talent and get them trained in a very short period of time, such as working with your local high schools. There's a growing trend where high school seniors are trying to graduate with their diploma in one hand and a certification in the other. And what great opportunity is that for a person who might not be college bound immediately, or because of some life challenges or their schedule, they need to start working right away. Well, isn't that a great thing to have a credential, a certification that could eventually articulate towards a nurse degree program that you could potentially help subsidize over time? That's another strategy. The other question, really the challenge, I'd pose to the audience is, are you working very closely with your local workforce agencies and offices? There's a huge shift in federal and state funding dollars to go towards incumbent worker training, to go towards apprenticeship training. And these offices are actually very good at recruiting net new talent that you can train in a very short period of time. The other thing is we can help even just advertise locally. Like, imagine if you're someone who might be a job seeker or stuck in your current role, and you see an advertisement that says, wow, within 16 weeks, I can become a surgical technician or a sterile processing tech or a medical assistant with no cost, right? And in turn, you can commit to working there for 2 years. So there's certainly the supply out there. We need to collectively actually increase the awareness of these types of opportunities and a type of educational attainment that doesn't come with, loaded amount of debt. And it's a great path towards a degree program over time.
That makes sense. And, with the one big beautiful bill, and we're still having discussions on enhanced premium tax credits, margins at hospitals are going to really be squeezed. And they're going to have to be careful on everything they do to look at return on investment. So as we look at return on investment, I'll pose this to both of you. What do you think the ROI, return on investment, metrics today should be? And then how do other funding streams reshape the financial picture of how the hospital looks at workforce? And then I guess, Jason, to you,
Yeah.
even though Workforce Pell is a funding stream, can you kind of, after y'all answer that question,
Sure.
give our audience just a quick definition of what Workforce Pell is?
Yeah, absolutely. I definitely want to answer that question, but the first thing I'll say is what a ROI metric and KPI shouldn't be. And it's interesting because it is today with some employers I've been talking to, and that's education as a benefit. That's the continuing education dollars available to your current employees. Some, actually, a notable amount of employers think a good success measure is how much money is spent towards tuition reimbursement and continuing education. That doesn't help really anyone. Individuals might be going through a program that isn't going to help them increase their wage. It's not going to help them upskill, and it certainly isn't going to help you solve your critical staffing shortages. So if you are using education as a benefit and tuition reimbursement, one of the metrics I would look at is where are the dollars spent? Are you intentional about promoting a very specific program and occupation internally? And what's your success rate on filling those critical staffing shortages? And the common metric across the board should always be retention and vacancy, right? Are those improving, right? I think some of these strategies are great for retention, right? You want to help that student along their journey, continually upskill. And healthcare is one of the clearest paths in clearest industries for such thing to exist, because there's just that career ladder, right? Going from certification to higher degree program. To answer your question around, different funding sources, and, I hate to be repetitive, right? We talked a little bit about growing trends in incumbent worker training funds, which obviously would help offset any internal budget or pain point that you may be experiencing, growing trends in funding for apprenticeship training. But to be very specific, right, to answer your question regarding Pell Grant, this is a great opportunity. This is something that, The education market has ultimately been fighting for decades. What this is, and it's launching this summer in 2026, is that now federal financial aid will now apply towards short-term certification programs, whereas before financial aid was only available for degree programs, associates, bachelor's, doctorate, and above. Opening this up actually opens up a much larger audience who wants to potentially enroll in some of these short-term certification training programs and obtain some financial aid for it. Now, there's some restrictions there's a framework for Pell Grant. So an institution can offer a program and be eligible for Pell Grant if the programs are roughly under 16 weeks of duration. Generally speaking, they're under $10,000. They lead to a nationally recognized certification. There's a clear correlation between the program itself and the occupation and certain wages associated with that occupation, and then job growth. And so again, this is just really an immense opportunity for universities and colleges to launch these sorts of programs and expand funding sources. And I think, it behoove everyone to, have close relationships with their academic partners to kind of follow along the launch of this and to collectively collaborate on, hey, I have these shortages, and how can you help me, right, with this hidden workforce, and what additional funding streams are available, this being one of many, right? Just have that close relationship, because I think right in the summer, as early as this summer, this is going to be a great opportunity to increase the supply of credentialed and job-ready talent.
Yeah, Steve, I would add a couple of comments to the idea around funding, because of course it always comes down to the money, right? How do you pay for it? It sounds like a good idea, but how do we actually pay for it? And I think one of the things that we really believe in is this concept of braided funding sources, where you're tapping into various types of resources and bringing them all together so that the cost burden isn't on any one party. It's not 100% on the employer. It's not 100% on the employee or the learner. And you really can tap into so many resources right now. In addition to Workforce Pell, which obviously we're really excited about the possibilities there, because I do think it's going to be a game changer. But also, we know that the workforce boards, the State Workforce Commission, but then also the local workforce boards have actually a lot of money available for things like incumbent worker training that often goes unspent. Now, we know that applying for, government grants can sometimes be a little bit arduous and tough to navigate. And I think that's where TWU and a partner like Skilltrade can really come alongside an employer and help them to navigate it and even, complete some of the application process, because we continue to hear from our local workforce boards that a lot of those dollars are available. They would love to be able to deploy them, and they're just not being utilized. Philanthropy certainly is another source. We at TWU, have some good experience in working with the local foundations and philanthropists to pilot some programs that, are high value that then can be scaled. Jason mentioned the education as a benefit and professional development dollars. I think, there are just lots of creative ways to fund these types of programs that, again, kind of spread the cost burden across multiple parties.
Monica, it's funny you say that regarding like the dollars are available, but they go unspent. At Skilltrade, we were awarded a grant in Alabama. It was Alabama 6, which is a county and district, encompassing a few cities. And the part of the grant was you have to bring employers to the table who identify internal candidates to upskill. And we, through our business development efforts, were able to secure some of those relationships. And that's why we were awarded the funds. And our counterparts within the county in Alabama, they were ecstatic. They're like, wow, this is great, because we haven't been able to deploy these dollars, and these dollars have a real impact. And it's just funny just because this is like a growing trend, right? The dollars are available, but no one really knows about them. And that's why having collaborative approach and partnerships between employers and workforce platforms and universities is just a great approach, because collectively we can identify different funding sources and even help guide you through that process on how to obtain them, because trust me, they're there, right? You just have to know where to look and how to apply for them.
Yeah, it brings up a good point. So kind of peeling back the onion a little bit more, let's assume a hospital says, okay, I'm interested in flexible pathways, and I'm very interested in the TWU skill trade model. But you got to realize I have to have a program that works inside my real operations. I have to deal with shift schedules, staffing constraints. Can you walk us through how this model works?
Sure. Well, I think that's the beautiful thing about this model is that it's ultimately flexible and can be customized for the specific employer and addressing the barriers that their employees have to continuing their education. We look forward to actually co-creating exactly what employers need on site, on their premises, during hours that work for their employees. And we certainly have the ability to offer trainings and coursework and clinical courses at TW Dallas in partnership with Skilltrade. But if it makes sense for you to offer it at your location on weekends or evenings or off shifts, I mean, those are all things that we can do in creating a customized model, because the curriculum itself is ultimately flexible, can be offered online, synchronous, asynchronous. I mean, they're just options are endless. Jason, what would you add on that?
No, I agree. That is what we're hearing too, as well, in terms of a pain point. And, I think the traditional models, specifically, right, they have maybe a couple start dates a year. The programs might be prolonged. They might have very fixed schedules. Not in addition to that, even if it's a hybrid program, right? Even if it's, you have your 100% online programs, you have your 100% in-person programs, then you have your hybrid programs. Even if it's a hybrid program, those internal workers, they still have to go to a campus. They have to drive, right? So that's obviously very disruptive for the schedule. So when we work with employers, right, we talk about, well, what's a good start date? How many start dates a year, right? That's very nimble. Number two is, how many hours in a day, if any, do you want someone to go off the floor and go through a training program? Maybe it's 1 hour a day, or we've had an employer say, you know what, can you actually create this program in 10 weeks? Like double the amount of study time in a week. And that's all these people will be doing. They're new talent. We bring them in. We want them trained up and ready within 30 days. Then they'll hit the floor. That's an option, right? We can customize and configure the curriculum and the learning schedule to align with the shifts. And going back to kind of what I said around transportation, what's interesting about our model, in one capacity, right, we intend to use the simulation centers at TWU to host our hybrid training curriculum, but we can also recruit an instructor, onboard them, and deploy them on site to your location. We can ship consumable supplies on site to your location. So as part of the training, students are actually getting hands-on training inside your facility per your schedule. It could be on a Saturday or it could be on a specific weeknight. Or we have examples of working with very large, reputable healthcare organizations where they look at our in-person training and our lab guides and they say, you know what, this is great, but we have someone in our operating room already who could teach this. And it's so clear and so detailed that, would you mind licensing that part of the curriculum to us? And we'll just teach the in-person components rather than having someone from the outside come in. It's really a flexible model. It's very agile, again, customize the kind of schedules, but also, provide in an affordable way that hands-on training that is so important before someone hits that role, even before they hit a clinical rotation or an externship.
So, as we talk about credentialing, how can short-term credentials serve as an effective entry point, let's say for allied health professionals? And what modern apprenticeship models are you seeing that are changing and evolving?
Jason, do you want to take the apprenticeship and then I can tag on?
Yeah, absolutely. I feel a little bit repetitive here regarding the apprenticeship components, but I think it's a really exciting opportunity. You're right, there are funds available. With an apprenticeship training model, it's a little bit different than, your traditional curriculum hybrid, right? It comes with, 2,000 hours of on-the-job training, right? There's some reporting associated with it, but in kind of over the phase of an apprenticeship, their wages are generally increasing. but it's also a really good opportunity to get to know someone, make sure that they're going to be a good long-term fit for you. You know, and then there's kind of like there are reporting aspects associated with it, which, you know, we can certainly help do that. But kind of before I turn it over to Monica, I would maybe even tee this up a bit. I alluded to this earlier in that healthcare is like one of the best markets and industries for stacking credentials, right? So short-term training can get you in the door, right? You can become a patient care technician or medical assistant. But then what's the next step, right? Maybe an associate's degree or bachelor's degree to become an RN, right? I think like, and then there's potentially healthcare administration you can convert into, right? There's just so many different areas. Once you get in the door without debt, right, you're kind of additionally attaining those credentials and potentially articulating some of that transfer credit from a certification program into a degree program, which saves you time and it saves you money.
Yeah, I would agree. I mean, I think, you know, TW seeks to be here for lifelong learners and someone really, you know, looking for educational opportunities throughout their entire career. And so these short-term certifications are really to help get someone in the pipeline and get them started and earning, you know, earning experience that ultimately, you know, can be evaluated as credit for prior learning into a bachelor's degree or even into, you know, an advanced degree. And I would say, you know, it's not just about nursing. I mean, certainly we offer lots and lots of different disciplines at TW that, you know, even a brand new degree program in medical language translation for, you know, native Spanish speakers. And, you know, those positions are highly sought after and really attractive to someone who maybe doesn't want a clinical role, but wants to, you know, work in a hospital in a healthcare setting, works, you know, directly with patients and with clinicians. So there are just lots of options that I think, you know, as someone starts to earn more credentials and get on that path to education, whether it's completing a bachelor's degree, pursuing an advanced degree, you know, we want to be here for them and have opportunities for them to seamlessly come into the university through these short-term certifications.
You know, Monica, I thought it was really interesting the way Jason talked about education as a benefit versus, say, sponsored training. And I don't want to be repetitive, but from a TWU perspective, what models do you feel are best to ensure that you support retention of the staff and at the same time deal with hospital vacancies?
Sure. Well, any type of education benefit, right, is great for your employees. But I think in this case, a sponsored training actually has more benefit for both employees and employers. So Jason touched on this earlier that, you know, a lot of organizations will offer some type of education benefit, tuition reimbursement, where the learner or the employee really is driving in terms of what they want to study and the degree path they want to pursue. And it may or may not be aligned with, you know, the vacancies and the needs within a hospital or the institution. And so the employee has some benefit to that, but in some cases you may be funding their exit strategy, right? So as they continue to get more education, it improves their options and opportunities even outside of your organization. Whereas with a sponsored training, you're really identifying, okay, what are the vacancies, what are the high demand positions that we are really struggling to fill? And can we offer training opportunities on site, on our premises, to specific employees who we feel like have a lot of potential, who have asked for opportunities for mobility and promotion and additional training. And so you're offering trainings in a specific role or a specific discipline that, again, map directly to your needs as the employer. So in those situations where it's a sponsored training model, there's, I think, great benefit to both the employee and the employer, where on the tuition reimbursement side, those more traditional models, I think the benefit swings a little bit more to the employee.
Okay, This has been a great discussion and a lot of good, interesting points, and sounds like y'all have done a lot of hard work. So now I'm going to put you on the spot. So I'm going to ask both of you, what is one step, in your opinion, that hospitals need to take in the next 60 days so they're ready for Workforce Pell and they're also ready for other funding opportunities?
I would say, if you don't mind, I'll go first. I would say in the next 30 days, right, hospitals should audit their internal hidden workforce, right? Who are potential candidates that you could upskill? And what are your current vacancy gaps, right? Also, what are your kind of retention KPIs currently? Once you identify those roles, right, most reliant on like expensive or even potentially what the most reliancy on contract labor is, jot that down, right? Once you identify that, raise your hand, right? Send us an email. We're happy to talk about it. We can sit down, we can map these gaps against viable options to either upskill or recruit untrained talent. We can discuss what are various funding sources that, collectively we can bring to the table to, really make this budget conscious. And then ultimately work towards an activation plan, right? Like ready to go before the end of the quarter. There's nothing stopping it. And I really do think that these aren't just like band-aids on a problem. These are long-term solutions that could really help you build a sustainable workforce, increase your retention, and ultimately improve patient care. One other thing I would just add, Steve, is like, raise your hand, right? It really could start as simple as, hey, we would like to work with additional training organization to host students in an externship, right? That's a great phase one opportunity to get started to help solve some of these issues long term.
I don't know that there's much more than I can add to that. I mean, I think it is that very first step, which is, really the easiest step, hopefully, is reaching out and let's have a conversation. Let's figure out how we can work together to really fill some of those needs that you're struggling with, that have an impact on your retention and burnout and all the challenges that, having a large, robust, healthy health care workforce, demands. And let's figure out, can we design a solution together? How would we help you tap into some of those dollars, those workforce dollars that we mentioned that are available now, as well as getting ready for the Workforce Pell dollars that are going to be available starting this summer? Let's make sure that, we're tracking the outcomes that the federal government's going to care about as it relates to, Workforce Pell and making those dollars accessible and available. But I think it starts with just a simple conversation.
While y'all was speaking, Julie put in the chat. Now I'm just going to read it. I'm sure most people saw it, but she did put this in. She said to feel free to reach out to TWU Ventures and Skilltrade for exploratory discussions, looking at current options and maybe ways to co-create custom solutions. And then she gave the link that you can click that takes you to TWU Workforce's solutions. So Julie, thank you for putting that in there. I think that's very helpful. Kind of keeping up on a timeline, what should a hospital do, or what do you think it would look like for a hospital to co-design and launch a, say, tailored talent pipeline over the next quarter? Any thoughts on that?
Yeah, absolutely. First, I would think about co-designing what a partnership looks like and not considering what a purchase looks like from a vendor. And so over the next quarter, I would, number one, right, again, define your specific clinical needs, right? And your scheduling constraints, or maybe your constraints with current preceptors. Number two is then actually outline a roadmap to launch recruitment efforts and pre-screening criteria, right? Recruiting untrained talent over here and recruiting your hidden workforce from within, right? Again, looking at all the different sources of talent that you could recruit and pull in. And then also, potentially work with us or other partners on identifying the various opportunities in the organizations within your region who can help obtain funds across everything we talked about, from incumbent worker training to apprenticeship training, to actually, helping underserved populations with wraparound services, who aren't in the workforce, help them get into the workforce. Just an immense amount of opportunity and funding, and I just think it just starts by putting pen to paper.
And I would just add a couple of things. I mean, I think Jason mentioned this earlier, but really thinking about how as an organization are we spending dollars on either tuition reimbursement, professional development, continuing education, and are those dollars being spent in the most strategic way? Is there a better way to deploy those that again benefits both the employee and the employer? I think that's a really interesting exercise to think about in this cost-conscious environment.
Yep.
Before we end the questions, I do want to challenge our audience, and we've got, a good number of people on, and I've looked through the list. We've got some very talented people that are participating today. So, audience, here's the challenge. What do you think in your mind, after hearing what Monica and Jason have said, is one move you could make, say in the next 30 days, to start building the workforce pipelines that you're going to need in 2026 and beyond? And just put it in the chat. And I'd love to see some of the ideas y'all put in the chat. And then I think Jason and Monica can probably look at those and give you some advice on internal pathways you could do. But before we get to that, so I hope the audience will put some things in the chat. Monica, Jason, what questions should I have asked you, or what point did you want to make that maybe we haven't made thus far?
I think you nailed it, Steve. You asked all the right questions from my perspective. I think probably when we end this webinar, I'll probably have a better answer. But I think you did a great job. And, hopefully if we really missed anything, or frankly, if the audience thinks, we're thinking about things differently than you do, we'd love to hear from it. Again, kind of that collaborative partnership approach. But I don't know if Monica, you had any other insights or answers to that question?
Yeah, no, the only thing I would underscore is just this idea of how can we eliminate barriers to really helping individuals achieve economic mobility and have fulfilling careers. I mean, I think all of us who work around the space, know that healthcare can be such a fulfilling career, and that the industry really needs talented people who are compassionate and kind and really committed. And to Jason's comments earlier about that hidden workforce, I think you all have a lot of these people already within your organizations. And so, how do we remove the barriers to really helping them excel and achieve not only their passions and career dreams, but where it's really truly a win-win for everybody. I think that's the way to look at this. I mean, yes, you have needs that you have to fill, but I think on the individual level, there are just lots of opportunities that institutions like DW in partnership with Skilltrade and the HR teams represented on this call can be doing a lot to really give those individuals a great boost.
Yeah, I'm looking in the chat here, and here's one that came in. We're going to strive to develop relationships with training programs and plan events for trainees to build better relationships. That was just kind of a thought that came in. I didn't know if y'all had any comments on that. I guess that was going back to my question. What are some of the things you're going to do to start building the workforce pipelines at your hospital?
Yep. Yeah, I think it's a great thought. Again, there's a lot of opportunities. One interesting, we've been working with the hospital system, and they've been doing a lot of like on-site career fairs with the local high schools. And it's yielded a lot of interest with building a sustainable talent pipeline and getting people interested in new roles. And hopefully solving some of their issues. So that's just one of many examples of an event that could work out well.
And on the
Here's another comment. Excuse me,
Oh,
Monica, go
No,
ahead.
I was just going to say on the building relationships with training programs, I just think that I would encourage you to, it's a two-way street. It's a two-way dialogue, right? You want to make sure that that training partner is really meeting your needs with their curriculum and the modalities of delivery. But even, within our traditional academic programs, we've got great clinical partners at TW, and we are constantly looking for feedback from them about, what can we do differently or better, or how can we prepare our students to be in the world of AI and all the changes that are happening. So when you, really seek out those training partners, it should be a two-way dialogue to make sure that they're meeting your needs.
We've got a couple other comments that have come in. Got 2 or 3 coming in. That's great. Workforce Dallas and Goodwill Dallas are now partnering with healthcare employers to launch a career-focused medical assistant training cohort. So that's not a question, but I think it's Monica basically saying Workforce Dallas and Goodwill Dallas are helping do some of these things.
Yeah, and that's where, we love Goodwill Dallas because they do provide a lot of those extra supports that someone would need to not only enroll in a program, but to persist. And so Goodwill is a great partner of ours, and we continue to have lots of conversations with them about how we can expand the ways that we're working together.
And I think somebody put in the chat, if you're an employer interested in connecting in the Dallas market, please let us know. And they put a link in. So that's good. Here's another comment that I thought was very good. We are encouraging internal mobility because we are now hosting quarterly events to help our existing employees discover internal growth opportunities as well as coaching.
I love that idea. Because think about your existing employees may not know about opportunities within the organization. And so if you don't even know that those things are possible, you're not going to pursue them. You're not going to raise your hand. So I love that idea of hosting those events to allow employees to explore positions and training opportunities that would be available to them.
I don't see any other comments or questions pending, but I do have kind of one final question. And Monica, you chime in. I guess it's a little more directed towards Jason. In the work you have done with hospitals, do you deal with the chief nursing executive, the chief human resource professional, all of the above? Who are the target people that you really need to get the message to help them understand some of this funding that you talked about?
Yeah, more times than not, it's always senior leadership within HR and talent acquisition. Sometimes it's senior leadership and learning and development as well. But also sometimes it's presenting to the CFO because there's a real ROI associated with some of these models. So it really does depend on the health system, but largely I'd say a majority, again, senior leadership and HR, learning and development. And then, obviously, like you mentioned, leaders within nursing for sure. So it's always different, but mainly that.
Hang on just a second. I got another new message. Okay. Got some real nice thank yous to both of you for what you did. As for external candidates, with 65% of your future hires already being in your applicant tracking system, do we all need to scour our databases to re-engage the talent that is sitting there?
I personally think that's a great opportunity. Then the question becomes, those that applied, are they credentialed already, right? Like ready to go on day one, or perhaps they were someone looking to build a better future. And so if that's not the case, you could potentially help them obtain a different occupation or that same occupation through, short-term certification. Let's say someone was interested in sterile processing. You don't have any sterile processing roles, but you have a surge tech role. What a great way to upskill a sterile processing tech to become a surge tech. So I would look at it, but also look at the credentials of those individuals. And then based on what you learned today, maybe there's a gap you can fill in a very short period of time. I hope I understood that question accurately. If not, Bruce, please chime in.
Monica, do you have anything to add?
No, again, just look forward to working with the healthcare providers and partners on the call. TW has a long history of, really filling the workforce needs in healthcare, in particular in Dallas. Going back to the 1950s with our partnership with Parkland Hospital. But we are thinking creatively and innovatively about how we can do even more and have a greater impact within the education ecosystem here in Dallas. And so we're just super excited about the partnership with Skilltrade, this new portfolio of offerings through TW Ventures, and would love to work even more extensively with the partners on this call.
And Julie is really helping us. She's put some information in related to the TWU Dallas president, Monica Christopher, and even put her email in there. So you may get a bunch of emails, Monica.
Well, I'll look forward to it.
Yeah. Listen, this has been fun. I mean, I enjoy webinars, but I really like it kind of this panel discussion, for lack of a better term. And I think, Monica, you and Jason just did a fantastic job. But before we close, do y'all have any final comments you'd like to make before we end this webinar? And I'll go to you first, Monica.
Not really. I think, there are lots and lots of possibilities, and taking the first step is easy, and that's just a conversation. I think in many ways the stars are aligning with some of these new federal and state dollars that are available. We certainly understand the economic pinch that so many of our healthcare institutions are feeling, and the difficulty sometimes in finding resources to invest in this way. But getting back to our conversation about the ROI, gosh, if you can retain great employees by providing pathways for them with training programs on site that match your needs and the vacancies that you're really having difficulty filling, then I think it's just a win-win for everybody.
Great. Jason, any final closing thoughts?
Yeah, I would just say, generally speaking, I don't think the healthcare staffing crisis, I do call it a crisis. I think it is and will become even more so. It's not going to be solved by recruiters. I mean, they're certainly part of the equation. You absolutely need them. But I think it's going to be solved by, talent architects. And each of you on this call, in my opinion, has an opportunity to be, a driving force and an influencer internally in your organization as a talent architect. And, these models, they exist, they're proven. And, it's really funny. I recently heard someone call it like apprenticeship training. They use the analogy. They're like, you know what, for the longest time, this was, one of the most popular things. Now it's becoming popular again, and the bell bottoms are back. So let's just, think about it that way. It's a good opportunity. So.
Well, in the chat, we're getting a lot of nice comments. People really appreciate your presentation, your information, your insight. So I think y'all are rock stars now. So there you go. But we really appreciate this discussion. We want to thank you for excellent presentations. We thank you for the really thought that you put into this and the suggestions and looking at ways to not only help hospitals with vacancies, retention, but looking at it through the eyes, as you mentioned, Jason, the CFO, from the return on investment. So on behalf of everyone, we want to thank you. There is one question. Is there a transcript available for the meeting? Chris Wilson, who does an excellent job for us, is going to make sure this is recorded, and the recording will be made available to everyone that registered. So even the people that maybe their schedule changed and they missed this, if they registered, they will get a recorded copy. Thank you for that question. with that, we want to thank y'all again, and we will end this webinar and hope everyone has a good afternoon. Thank you.
Thanks, Steve.
Thank you.